Welcome to the Iron Self podcast, where we jump into health, fitness, mindset, and becoming the best version of yourself. Today with your hosts, Mike and Kayla Minion. Welcome to the Iron Self podcast. On today's episode, we welcome Dr.Josline Hampson. She's the owner of Elements Health in Spruce Grove, Alberta. She graduated from Canadian Memorial Chiropractic College in 2003 and has been practicing chiropractics in Spruce Grove, Alberta since 2015. Dr. Josline is proficient in many techniques, including the activator technique, and is certified in the Webster's technique to provide care for expectant mothers. She's also trained to provide care for children through the International Chiropractic Pediatric Association. Thank you so much for taking the time here today, Dr. Josline. We welcome you.
Awesome. Thanks for having me.
We're excited to have you. So what really drew you to become a chiropractor?
So I was thinking about this today, and I have a couple of stories, so I'm going to tell you both. So I come from a family of healthcare workers, right? My mom was a nurse, my stepmom was a nurse, taught nursing, wrote the textbooks. My auntie was a nurse. So I think just naturally after high school, right? I went to nursing school. I applied and I got in, and I was a couple years into nursing school, and I just was like, I love healthcare, but I'm not loving nursing, right? Didn't like the hospital-based care, and this was 92, so there wasn't community nursing was just kind of starting to kind of make its way into healthcare. And I kind of knew that I was going to stay the healthcare course, but there had to be something else. So my sister was in high school at the time. She was a few years younger, and she'd had a bad trampoline accident. So they were out of province, and I remember my mom calling me. She'd been deteriorating for a year. So at this point, my sister is at a new high school. She's got no deep tendon reflexes. She's limping, they've tried everything. She's in and out of the hospital, it's bad. And so my mom calls me one night and she says, I left the hospital, and a nurse kind of had pulled my mom aside and said, I've seen you here 10 times. You got to take that kid to a chiropractor. And so my mom calls me and tells me this. And I remember being really scared, almost mortified. What are you thinking? This is the 90s, and nurses are thinking, chiropractors are literally quacks, right? I remember thinking, you take my sister there and we're going to be in big trouble. This is sort of the perception at the time, right? And so my mom says, well, I'm going to take her. And I was like, little nervous. So they have an appointment the next day, and sure enough, my mom calls me right after, and she's crying, right? And I'm like, I knew it. That was a bad idea. You shouldn't have done that. And what's wrong now? And my mom's crying because she's like, your sister literally walked out of there. And I was like, what? She's right? She's upright. She doesn't limp. She literally walked out of there. And I remember thinking, oh my God, right? How did this happen? This is a miracle. And when I tell this story, it's kind of wow, in 17 years of practice, I'd say I thought this was the norm. And, so in 17 years, I'd say what I've had kind of 2 miracles, but this was my first introduction. So I'm they're miracle workers. I want to be that. I want to do that every day. And so it had this profound effect on my family. And so at the time, I was still in nursing school. It's spring break. So I head out to see my parents and my sister, and she's walking, she's healthy, this is great. And so my mom's you got to go see the chiropractor. And I was like, oh, no, that's for miracles. I don't need a miracle.
That's for miracles.
So I remember thinking I was really suffering with back pain. In my teens, I had been diagnosed with a pretty severe scoliosis. They'd found it so late that they couldn't do surgery wasn't an option, back braces, those kids got made fun of at school, and I was just oh no, I'm just gonna take my chances. And so I always had a bunch of discomfort. My back always bothered me. I always sort of noticed a level of pain. And at the time when they found it, I don't know if we'd seen somebody, a specialist, and I remember him saying to me, like, so what can we do? And he's like, well, just don't ever plan on having a job on your feet. You might likely be in a wheelchair by the time you're 40. And I'm like thinking, oh my God, right? Like, I'm 14. And what bothered me more was that I actually wanted to be a hairdresser. So it wasn't the wheelchair part. It was the part where he told me I shouldn't have a job on my feet. And so, it was funny because I'm like, there goes my dreams of being a hairdresser, right? And so, I kind of let that sit with me. And then I was like, I'm not going to let that stop me. And so, in nursing school, you're sort of doing all the grunt work. And it was my first 2 years and I had a lot of pain. So I kind of, my mom said, why don't you come meet the chiropractor? I had worked for my sister. So I thought, yeah. So I ended up going, and I always say, here I am today, right? Like, my sister had a profound experience. I had a profound experience, and that was just it. I went home from spring break. I told my nursing profs I was dropping out of nursing school and I was going to go be a chiropractor. And so, 6 years later, but I did it. So
that's awesome.
That's amazing. Just like you said, you're already 2 years into nursing school, and then you have these like just mind blowing experiences, and you're like, I know I'm going to serve people. I just didn't know how I was going to serve them yet.
Yeah.
And I think that's a lot of the time when we get into a career, I think that a large part of it is that there was like a moment, that like turning point that was like, no, this is it. This is the one.
Yeah, it was pretty cool. I got to chiropractic school and I was like, why are you guys here? And, some were like, my mom's a chiropractor, my dad's a chiropractor. And so, looking back at, everybody sort of had this sort of profound like past that led them there. And for some, it was family. So one of my kids hopefully will become chiropractors.
Pass the business along.
Take over the clinic next, right? Yeah.
Whisper it in their ear.
Yeah.
Right? One of the big things we know is that everybody, like, I'm not going to say everybody, but when we did our stats, it was like something like 60 to 70% of the population suffers from back pain.
From no specific onset, just back pain in general, right?
And so what we wanted to ask you was, what other kind of types of conditions do chiropractors treat? Because I know it's not just back pain, but I know obviously that's a large part of your clientele, but maybe you can enlighten us.
Yeah, so, when patients come in, I always tell them that, right? Like, we're going to look at your back because chiropractors are back doctors, right? But we look at the back because that's where the nervous system is. That's, housed in the spine. Our back is our nervous system. So really, chiropractors have always been sort of, we've been known as back doctors, but really it's that nervous system. So I always say we're nerve doctors. We're looking at that nervous system. So how that affects like head to toe. So whether that's, headaches, concussion. The first chiropractic patient ever was a patient who was deaf and he was a janitor. This is, over 100 years ago. The story goes he was like a janitor in a building, and this gentleman was sort of experimenting with like osteopathic medicine, healing arts, and he's like, oh, something's like out in your neck. And so he did this first chiropractic adjustment, and sort of immediately following that, the story goes like he could hear again, right? So again, that nervous system connection. And we don't treat asthma, but we talk a lot about, when we move down the body into the chest, like opening the chest up so patients who suffer from asthma can breathe. That rib cage is going to move better, right? And then as we move into the hips, like we'll treat traditional things like bursitis and, osteoarthritis and plantar fasciitis. It's sort of like there is really head to toe in what we treat. And then a large part of our, our clientele, or sort of what attracts people to chiropractors is like, sort of this prevention idea. And so people will say like, well, like my wife came and said that it helped her and I don't really have anything wrong, but let's make sure there isn't anything wrong. So there's the treatment component and then of course the prevention component too. So
I love that people are seeking it out as a preventative measure, like as that like alternate health measure, because I know, like, at least I started going to a chiropractor when it was the 90s, and it wasn't really like an alternate practice then. It was like, oh, I had onset whatever this issue was, let's treat the issue. So the fact that people are already seeing it as like this is a progressive measure. This is something that I need to do, just like going to the gym.
Right.
Yeah, no, and it was the same for me. I mean, I'm lucky enough that my parents were big on taking me to a chiropractor when I was younger.
Yeah.
So again, it was like 7, 8 years old because I played sports my entire life. I beat up my body pretty good, and they made sure that we were always going to see our guy. Dr. Howrap was his name, great guy,
Cool.
back in Ontario, and yeah, it's one of those lifelong things, and it's crazy because there's so many people that I know, even at my age and older, that have never been to a chiropractor and they live in chronic pain, and I'm like, have you not heard of this thing called a chiropractor?
It's magic.
Right? So, and I mean, we have people come to us and we're like, okay, well, we can help you strengthen the muscles, but the reality is, if you're out of alignment, you can strengthen the muscles all you want, but you're just strengthening an imbalance, right? So you're already strengthening on top of a movement dysfunction. So, yeah.
We've been taking our kids to the chiro since they were little, and like our oldest, she had like pigeon toes when she was a toddler, and she always would walk like that, and she'd wear like the outsides of her shoes.
Yeah.
And we just happened to be at like a health fair, and they're like, "Oh, you don't take your kid to a chiro?" And I was like, I never thought of it. Like I always go, but I never thought to take her. And after 3 treatments, like she was no longer pigeon toe. There was no longer that issue.
Yeah. And we talk about that, like, especially with kids, right? And as their spine and their body's growing, like, there's sort of an analogy in chiropractic, right? Is like, as the twig bends, so grows the tree, right? So it's this whole idea, like, if the twig's going this way, that's the way the tree's growing, right? And so it's sort of this idea that, like, to have the impact when they're younger, right? It's easier. Kids respond faster. Their bodies are in a healing, turning over state a lot more rapidly than ours. And then they're less likely to kind of go out and ruin the work, right? So their bodies tend to hold an adjustment better.
Kids in general, they spring back so much better after all injuries. Or not injuries in this sense,
Right,
but anything done to their body, they respond so well, right?
Yeah.
I guess one of the questions that comes up that kind of piggybacks right on that other one is, in your practice, what do you see most often? Like, if we're allowed to ask that, what is the most common? You see it all the time. It's almost like you can tell when they walk in the door they're coming. Is it just like non-specific, or?
Yeah, I think, like, sort of as you grow in practice, as you do in anything, right, you sort of develop a niche. So I mean, I think if you'd had asked me I've been in practice 17 years, going on 18. And I'd say that in the first sort of 5 years of practice, it was like sort of your low back pain, neck pain, headaches, right? And then you sort of start to develop niches, So I think for me, that niche sort of did become like, kids and families. So I'd say now, I'd say at least the majority of my practice is definitely more preventative, which I love. But that's like after 17 or 18 years, right? So now I'm a good 55, 60% of my practice is, it might have brought a family member in with lower back pain, headaches, neck pain. Then the remaining family members, 2, 3, or 4 family members are coming in for that checkup. So prevention and more maintenance. But I'd say certainly in general, general chiropractors is definitely like low back pain, neck pain, headaches. So sort of the top 3.
I feel bad. I apologize now because we live so far out that when we come in, it's normally like, oh man, we did something.
Yeah.
We're not 40%.
Yeah, we're not those people that are like booking those repetitive. It's like, okay, I have an issue.
But that's always a part of practice too, right? I think that's like anything. And that's part of how I run my practice is I tell patients all the time, I'm always going to tell you my best recommendation when I think you should come back. But that's the beauty of it is it's always up to the patient, right? So then I tell them you can come when you need to, or you can come in 2 weeks, 4 weeks, 6 weeks, right? And so, there's a huge, still 40% of patients that will come sort of as needed. And that in my practice, that is okay. That is how the work, that's the reality of it, right?
The interesting thing for me is that I noticed that when I worked a desk job, I saw a chiropractor way more often.
Yes.
And now that I'm not working a desk job and I'm moving all the time, I think I come in like maybe once a month, kind of once every 2 months or so. So it's like way less often. Yeah. Do you think that there's like a little bit of science behind that?
Yeah. So like in 2015, the World Health Organization said that seated workstations were the smoking of 2015. In other words, they were so bad for you that like they likened it to cigarette smoking. And so there sort of became this whole idea like, oh my gosh, stop sitting at work, right? And everybody moved to standing desk station. And then like within a relatively short couple of years, we were like, oh my God, standing all the time is no better, right? And so we're like, everybody sit back down. But so when we sit, we compress our discs, and they sort of like small discs all the way to the lower back, big discs. And so the more we sit, the more that compiles, and we load those lower back discs. So the idea is to get up and get moving. So it was actually a group of physiotherapists out of the UK who said, okay, we got to look at this. Sitting all the time is no good. Standing all the time is no good. What's the idea here? So
where's the happy medium?
Right. And so the idea then became what we see a lot of now is that sit-stand conversion. And so the research right now is that you should sit when you need to, but only for 2 minutes. And then you should stand back up. Now you might last 1 minute or you might last an hour, but once something hurts, your neck, your back, your toe, you sit for 2 minutes. So I tell patients all the time, when you move to a sit-stand conversion or a sit-stand desk, like you're gonna be up, down, up, down, up, down, till eventually you're just listening to your body, right? Like you're sitting 2 minutes and then you're getting back up, and however long you last, then you sit for those. So you do want an easily convertible desk or like a sit-stand conversion that moves quite maneuverably, but that's what the research shows is so. And the idea behind that, I think anyways, I'm not sure the research has proven this point, but we have this idea we talk about a lot in physiotherapy and chiropractic. We talk about motion is lotion. So it's kind of this idea that, oh, wait, like, are they just sitting and standing? No, they're moving their body. They're up, down. And so that movement is key too, right? To not be stuck in any one position for too long. So that's where the science is at today anyways.
I love that. Kayla always says motion is lotion. That's like her favorite thing to say is motion is lotion. So that works beautifully. One thing that stuck out to me that you just mentioned a couple of seconds ago, or a couple minutes now, but the ability to manipulate somebody's chest so that you can kind of get more of that thoracic mobility.
Yeah.
And I think that kind of lends beautifully into what I wanted to ask you next, which was more about, outside of just removing pain, what other kinds of things do chiropractors improve in their clients' lives? So a big thing for me is, with all of my athletes that I work with, we work a lot on proper breathing mechanics and learning just how to use the diaphragm and things like that. And the second you said that, just the thoracic mobility and being able to actually expand your chest and expand your ribs properly,
Yes.
That's what popped into my head. So I wanted to ask that question.
Yeah, so for like years, I mean, our profession was like so focused on what we called primary parts of the spine, right? We focused on the cervical spine and the neck and the lumbar spine and the lower back. And there was this whole idea for years, like probably over like 80, 90 years, that the thoracic spine was just like a secondary curve, not really significant. And then we started to see like, and again, a lot of this was like case studies or anecdotal evidence that chiropractors were seeing in practice, right? Like, why would an adjustment, how would that improve asthma? Like, was it a cervical spine adjustment? And so there sort of became this evidence that, like, yeah, the thoracic spine was more important than we thought. Like, it did have this primary role. And so, yeah, like the idea of opening up that thoracic spine, opening up that rib cage that's directly connected to it through these 10 joints, was that moving that could help. So we could breathe better, and that would help patients with asthma. But then, yes, patients with scoliosis, and then we'd see improvements in patients who had just, overcome a cough, a cold. We thought, we're having an effect on their immune system. No, we're actually we're helping them breathe better too, right? So,
Just functional, yeah.
and we see that too in the neck, right? Patients would come back and say to me like, I came because I had a headache and you adjusted my neck, but then like I didn't tell you I was dizzy all the time, and now I'm not dizzy anymore, right? So like sometimes we see those I tell my patients all the time, these are the good side effects, right? Like sometimes it can help with dizziness, asthma. Heartburn's another one, like working on the thoracic spine and the diaphragm can help with heartburn. It can help with patients who in the lower back, we see that connection helping with things like, again, a positive side effect if they were suffering from constipation. So those are some more sort of organic things we see where, again, we're not treating those, but they're a positive side effect.
Yeah, no, it's awesome.
And you kind of talk about like treating like the whole family. So is there a specific age where maybe people shouldn't be seeing a chiropractor, or is there a lifelong thing?
Right. So, and I've always explained it to patients like this, right? Like, again, always a patient's choice, right? My job is to give a patient that information. My job is to tell you, what I think I can do, how I think I can help. And then it's always up to them. But I mean, yeah, I always say like newborn to 90s, right? I've seen patients on their way home from, being born at the hospital, hours or a day old. And then, I've seen patients that are in their 90s. Like my goal is to see somebody who's 100. So I got to track somebody down who's 100.
Anybody listening that's 100,
right? If you're call me,
we'll hook you up.
I'll come to your house. So yeah, newborn to 90s, right? And so the benefit is different at every age. In newborns, we're checking the spine after birth. In the 90s, we're checking the spine to help, keep mobility, improve function, decrease symptoms, right? So there isn't an age at which somebody shouldn't be checked. And that's sort of where it falls into, like I tell my patients, newborn to 90s.
So what kind of techniques would you normally use in office? Because I think when a lot of people like think of going to the chiropractor, they just think of like being like their back being cracked.
Right.
Well, a lot of people have that trepidation because they don't know what to expect, especially somebody who hasn't been to a chiropractor. They're like, what am I getting into?
Or somebody that's maybe been to, I'm going to say a not so great chiropractor, because I've had a couple people I've had to convince.
Yeah, like, and so, and let's not forget TikTok, right? People are watching TikTok, so they have this perception of chiropractors if they've never been, and now they've watched a TikTok video, right? Like, and so for the record, I tell anybody, they are all fake noises. Like there is no cracking that you're going to hear on audio that loud. I mean, unless you're stuffing a microphone in there, but at the end of the day, yeah, like traditional, like cracking that was the sort of the chiropractic roots. It's sort of where we came from. And we still see that today, I think, for two reasons. One, it works. And two, we've been able to just build and build on years and years of research. But what's come out of that is techniques where like patients or other chiropractors have said, you know what, like not everybody likes the crack. Like I tell people who are really nervous or leery about getting an adjustment where they're going to hear pops and cracks, like I tell them that's okay. Like my husband's been married to a chiropractor for 13 years and he's never had a manual adjustment. He does not like at all. No, I have always used different techniques with him. It's just not for him. He's obviously not afraid of getting an adjustment. Our kids get adjusted that way. He's like, I know it's not for me. So that's with him. I use what's called an activator. So it's like a little handheld instrument. It kind of looks like, well, it developed from a dental technique. So the story goes like about 40, 50 years ago, a chiropractor was next to a dental office and he goes over and he says, listen, like, I'm cracking and popping my patients and not everybody likes this. Like, there's got to be something else. And so the dentist says, well, like we have this impactor that we use to, put fillings in and do work in the teeth. He's like, let's try this. And so they literally grab a door stopper, like the old fashioned little door stopper. So they grab the little, plastic piece from the end of the door stop, put it on the dental impactor and start playing around with this. And hence we have a technique today that's called the activator. So, now we have 40 years of research and we have tools developed specifically for chiropractors and we have settings. And so that's like a great technique. Like people who don't want to pop in a crack, that technique is really sort of, I guess, attractive to them. And that's sort of there's sort of the top three. The other third is what I call it the table technique. We're literally using the table. So the table pieces are moving up and down and like, they move up and down about like a half an inch, but they feel like they're moving more, right? And so that technique was developed by Dr. Thompson. And so this is like 60, 70 years ago, he was an engineer, and chiropractic changed his life. Like, he got on a train in the United States, went across country to Davenport, Iowa, where there was like the first chiropractic clinic, and he had this crippling back pain. And of course, as the story goes, he had a life-changing experience with chiropractic. And he says when he's leaving, this is a week later, he's like, this is great and all, but you guys are like jumping on people and cracking them. And he's like, why don't you just use gravity? And they're all like, what? And he said, yeah, why don't you get the spine in motion till it hits an equal and opposite force, and that'll set the adjustment. And they're like, what are you talking about? So he's like, I'll show you. So he develops this table. It's called the Thompson table or the drop table. And again, there's history, right? Now, most chiropractors, not all, but most have tables where we use these drop pieces, and again, using gravity. So, and then you see all sorts of, chiropractors now, research is rapid. There's lots of techniques out there. Gonstead, those are those big heavy adjustments you see, Y-strap, there's more and more. But I'd say, traditional pop and crack, table techniques, instrument adjusting, those are sort of the top three.
I still love being cracked.
Yeah,
That's my.
I do adjustments all day long.
People go to the gym and they lift weights and they don't feel satisfied unless they get the muscle burn. I kind of feel that way about chiropractic. It's I'm not satisfied unless I hear the crack.
She needs the loud pop, the TikTok pops.
Yes.
Oh, man. So for the general public, anybody who may have not been to a chiropractor yet, what would you say some signs or symptoms might be to tell them, hey, it might be a good idea to go get checked out?
So I'd say that traditional stuff for sure, right? And for a lot of patients who haven't been yet, they've kind of sort of just said, okay, this is just the way it is, right? I'm going to put up with this. And so it's sort of getting to that point where they have to kind of say to themselves, you know what, there's got to be something else. I shouldn't have to suffer with headaches. I shouldn't be on pop and Tylenol, Advil, monthly migraine medication, and still suffering, right? So I'm not talking about those patients who, have the odd headache and respond well to what they're doing. But if they're putting up with something and they've just sort of said to themselves, that's just the way it's going to be, it's likely not, right? So that neck pain, headache, even lingering, we're seeing now lingering sort of symptoms, fog, headache, stuff from concussions that they've gone through their concussion protocol and they've still got some stuff kind of lingering from that. Chiropractic can help with that. That mid-back pain, absolutely anybody with this scoliosis should be checked by a chiropractor. And I tell all my patients who have scoliosis this: 1, I have it, and 2, don't let anybody, any chiropractor tell you they can straighten that out. The majority of patients who have a scoliosis, they have it. Now, there are some epic treatments out there that are being done by physiotherapists. A German technique that has been shown to actually reverse curves. I tell all my patients about that. It's very cool, the Schroth method. But I tell patients, for getting checked again, if you're putting up with lower back pain, and these are the things that they're not just that episode. You're right. At some point in life, 85% of the population will have a moderate episode of lower back pain. If you get that episode and it goes away, then great. If you're able to self-manage, you're able to do that. Fantastic. It's those ones where you're getting the second, the third episode. It's time to try something else. It's time to get your spine checked, right? Yeah. Knee pain, hip pain, foot pain, plantar fasciitis, those sorts of things where chiropractic can help. And the thing is that the great majority of chiropractors recognize our obligation to patients, which is this: if we can't help, it's still our job to find a patient somebody who can. And that is our duty and obligation. If we can't help, we're going to find you somebody who can. So we assess, we feel like we can treat or can't treat, but you know what, somebody else is going to help you better. We're going to tell you that. And so the assessment is that key part that starts a patient going in the right direction. And certainly, I tell patients, if you're a couch potato, you need a chiropractor. If you are active, you need a chiropractor. And so the sort of those ones in between where it's yes, they'll benefit, but listening to their body and just not putting up with crap. People have become accustomed to just putting up with it, right?
Well, and that stood out to me when you said that. Just there's so many people that they have migraines, they have headaches, they have back pain, whatever it might be, and they do the the classic treatment of like Tylenol or whatever works for them, but it doesn't really work for them, and then they keep doing it. So then that turns into that the definition of insanity is doing the same thing over and over and expecting a new result, right?
Yeah.
So what kind of advice do you have for anybody that might be hesitant to see a chiropractor, or that has seen a chiropractor and maybe didn't have the greatest experience?
I tell patients, or like anybody, like people, like at the front desk, the girls will always say, like, somebody calls, they want to know, can you help with this? Can you help with X, Y, or Z? Or who should the patient with X see for this? And I think the thing is that in Alberta anyways, like in most of Canada, but higher in the province that I practice in, is there's a usage rate of about 15%. So they're saying about 15% of our population actually, regularly utilizes chiropractic care. And at first you kind of think, oh, is that kind of low? We're not talking about patients that have been to a chiropractor. We're talking about utilization rates. And so when our profession kind of looked at that, we're like, oh, that's so low. We actually went to the dentist and they're like, 50, you got 15%. Shockingly enough, our usage rate in the province of Alberta for chiropractic is higher than the usage rate for dentists, which means more people regularly go to the chiropractor than their dentist. I mean, shocking, but cool, right? I mean, cool if you're a chiropractor, not cool if you're a dentist, but.
Dr.J.
and so, we do see, particularly in our province, this like, everybody's either heard of a chiropractor, a great number of people have been to a chiropractor, or at least everybody knows somebody who's been, if that's our utilization rate. So I tell people, like, ask somebody who's been and had a good experience, right? Like, so that's sort of like, instead of, I'm 47, so I still know the yellow pages. So, I used to say, don't thumb through the yellow pages. And then it was Google, and now it's like asking on Facebook. But ask somebody who's been, like somebody who's had a great experience. I can assure you that, like you guys, you're like me, like my first experience, or, when you've had a great experience with a chiropractor, when somebody asks you, you're like, yeah, this is what you should do. This is where you should go, right? And so it's sort of gaining on people's experience because, chiropractors are different, everybody practices a little bit differently. So you kind of want to find somebody who is going to be able to, help the way you want to be helped or do things the way you want to do, right? Like I have a colleague who's amazing. Like he's huge into sports. He has his sports specialty, like absolutely amazing. I get an athlete at a certain level of sport, I'll adjust them, I'll check their spine, and then we sort of get to that next level where I say, you know what, you really got to see my colleague down the road, like literally down the road, right? And so again, you want to find, he doesn't adjust or crack or manipulate, totally does chiropractic differently. So again, sort of asking around, asking somebody who's had an experience is probably the best way to find somebody, because then kind of what, you're looking for.
Yeah, and I think that honestly, like, for us, it's a lot of trial and error. Like, we came from living in Victoria, and we had a good relationship, and I've been seeing that chiropractor since I was like 16. And then coming out here, we were like, oh, could you refer us to somebody? And he was like, oh, I went to school with this person. They live in that area.
Right.
And so we started going there, and I was like, oh, I hate this person. Like, this isn't the person for me.
Right.
And because so used to one way of doing something, right?
Yeah.
And I think I boycotted the chiropractor for probably like a year and a half after we moved here. I was like, nope, not going back to this person.
And I, on the other hand, because I had so many back injuries, I started looking actively for a new chiropractor, and it was over and over and over again, just trying to find the right one. But we get the same thing with people that have been with a personal trainer that didn't resonate with them, and they're like, I never thought I was going to work out again, never thought I'd like it again, and then us.
Great. So, like, I got a referral, I think, from, I want to say a massage therapist for you.
Yeah.
And it was just, one of those things when I was like, okay, I love her, and, like, I'm going back.
And that is it, right? Like, asking your other providers, like, particularly, again, I can only speak for our province, but in Alberta, the great majority of healthcare practitioners are what we call regulated. So you belong to a regulatory body, you have a license. And so, we have this obligation, right? Which means that we can't refer you to somebody who's going to give us a kickback, or we can't refer you to somebody who, there can be no conflict of interest, right? So, it's, it's their experience, yes, but then, they have to sort of take that conflict of interest out and look at it like, and that healthcare provider is really obligated to say to that patient, you know what, this chiropractor I think would be a great fit for you, or that massage therapist. Like, that's even in my own practice. I have 5 massage therapists who work for me, but I live in a community with about 40 of them. And I tell patients all the time, like, I have to refer you out, or my best recommendation is to send you to so-and-so down the street, because she does, something called orthopedic massage. It's so great for lower back pain, and none of our therapists do it. They're amazing, but they don't do this particular type of massage. And I know that's going to help you the best, or, cranial sacral. And so I sort of expect, I guess, the same sort of from my colleagues outside of my profession. So patients should be asking their massage therapist. I mean, heck, if you ask my optometrist, he has recommendations for dentists, chiropractors, so healthcare providers are also a good resource, and personal trainers. Of course, I'd be hard pressed to think of trainers who wouldn't have a great chiropractor in their pocket, that they know and trust, and at the same time, they go to.
Yeah, and it's super important, I think, to have those relationships, because that's really how we build community, right? Like, I know if I have a client that I can't help, and they're suffering from, X, Y, and Z for issues, I can say, hey, I think you should go see this person, and they're more likely to take my recommendation than, like you said, to like go on Facebook and ask somebody, right? Because when you're in that world, you tend to have like, your key people.
Yeah.
Well, and everybody, like, it's funny because referrals are one of those things where if we can't help, we're gonna refer you to somebody that can. And sometimes people like kind of take a step back and they're like, oh, like you don't want my money, and it's like, well, no, it's not even that. It's just I think you'd be better served over here, right? Like, I would love your money, but let's pass you off somewhere where they have a specialty that'll help you.
Right.
So, is there any kind of last things that you want to add to the listener that maybe they don't know about chiropractics, or that you'd like them to know?
Oh, I think, I think we're seeing a surgence of chiropractic. Like, certainly in the last 5 years, our profession has sort of gained more, I guess, popularity, for lack of a better word. And so we are seeing patients go more. We're seeing, utilization rates, usage rates, increasing. And especially in the last 16 months, patients have really, needed chiropractors, wanted to use their benefits up, needed to use them. I think the one thing I would tell patients is, if they have a chiropractor, these are the people I want to give the advice to. Is my number one pet peeve in practice is when patients say to me, I know you're busy, but, and I like, ooh, what I want people to know is that your chiropractor should never be too busy to answer your questions. I never want people to feel that way. So I think that I want to tell people, like, when you go, if you go, is always ask the questions, right? And know that your chiropractors, that's what they're there for. We're not just there to like crack and pop and jump on you and make you feel better. Like, we are really there to answer questions. And maybe that's about, activity, exercise, about your own family. You have a question about your spouse or your kids, or, so always make the time to ask the questions, and always find a chiropractor who's going to answer them for you.
That's awesome. I love it.
Yeah.
So if anybody wanted to reach out and message you for questions or concerns, how would they go about doing that?
So I always say email is like the best way to get a hold of me. And so I can be reached, like, our website is elementshealth.ca. And so, like, you can go on there, you can reach out to me. There's a contact us page, or my email is like dr, like Dr.Josline, at elementshealth.ca. So I'm always happy to answer questions. And you asked me earlier about people trying to find a chiropractor. Like, ask me, like, tell me, this is where I live. Like, who do you think, like, who should I see, right? Like if somebody lives an hour and a half away or 2 provinces away, like, it's always easier for me to kind of navigate a website or look that up for somebody. So I'm always happy to answer those questions too.
I love that. And I'm totally going to put all your information in the show notes so all the listeners will be able to see it there.
Thanks.
But I think that's all the questions we have for you today.
Yeah, thank you so much for your time again. It was awesome getting to do this.
Awesome. Thanks for having me, you guys.
If you loved today's episode and you found value with it, please make sure to share it with a friend, share it with a family member, and someone you care about. If you want to reach out to Dr. Josline directly, you can reach her by email at drjosline@elementshealth.ca. That's DRJOSLINE@elementshealth.ca, or feel free to check out her website, www.elementshealth.ca. Thanks so much for listening today. Have a lovely rest of your day. Bye for now.